Welcome. I'm Dr. Raj Iyer. I'm a real doctor training in New Jersey, USA. This is our live session on Ask the Expert. This is one-stop shop for all information on health for you and your family. I have a video on hair growth from about 6 months ago that you can check in the description below. The questions we will be discussing are those that our viewers asked in the comment section of that video, plus other questions that are relevant. First, let me tell you my story. My grandfather was bald and had a shiny head. My father is almost bald. Why am I saying this? It is because I'm genetically prone to baldness. Does that mean that my hair will all be gone? Although genetic factors are present, there are many things that could be done to continue to have a healthy hair growth. In this channel, we give information based on what is scientifically tested by doctors or based on experience or both. So keep watching. We will share all the secrets with you and break some of the myths that you believe are real. If you're looking for something you can put on your head and see instant results in like a minute or two, keep watching. I have some good news for you as well. Well, today I'm very honored to have Dr. Nutan Gupta. Dr. Nutan, thanks for being
Hello.
here.
Thank you. Thank you for having me.
So, Dr. Nutan is a very experienced dermatologist, a skin, hair, and nail specialist from Richmond, Virginia, in USA. In this weekend, Ask the Expert series, we have expert doctors from around the world who volunteer to take their time and come to this platform to educate you all. This is because no matter what part of the world you're in, we want you to be happy and healthy. If you're a returning viewer, you can always check out our other videos in Ask the Expert series by clicking this link. I want to welcome you all. If you're a returning viewer, remember this tends to be a long video because we tend to cover a lot of important things. You can always check in the description below to see what is important for you. And also type in the comment section and let us know if you want to hear about any other health topics. In every live session, I share two exciting things about our experts. So today, Dr. Nutan and I were residents together, meaning we did our specialty training together from PGIMER in Chandigarh, for which I am very honored to be a part of. That was so exciting days.
Well, you're being humble. You actually helped me when I first came and wrote my exam there, got a rank, and you helped me because you helped me stay in in the hotel, in the mess over there. So thank you very much for helping me when I was a younger student.
Well, this was my pleasure. It's all good times. And the second most exciting thing is Dr. Nutan actually does Bharatanatyam, and she's very experienced in that and does a lot of stage shows. So I have to show you a picture of one of the dances that Nutan has done. This is fantastic. Is Bharatanatyam your passion?
Yes, and the interesting part is I did not learn it as a child. As most of our viewers know, it's a very disciplined dance form, and most of the kids start when they're 6 or 7. But I started in my 30s to learn Bharatanatyam, and I fortunately found a guru here in Richmond to teach me, and I'm now an advanced student. We have a group of people who are learning with me, and we try to perform and spread the dance form, which we're all very passionate about.
Well, that's fantastic. So if you need to learn anything, age is no barrier. You can go learn anytime. And I have to tell
Yeah,
you, if you're new to Bharatanatyam, it's a classical form of Indian dance and is one of the most difficult forms of dance.
it is. It's also a very spiritual form of dance, so it's beautiful to tell stories and entertain people, and also connect the newer generation with our philosophy.
Hmm. That's great. So do check the disclaimer in the description below about our video and about our session. I want to remind you to post your questions in the comments below. And if you'd like to join live, check in the description below as to how to join live. I have left a link there. So let's get straight to questions, because we have a lot of important things. I'm very excited to know more about this. Uh, so people think they have too much hair fall. First question, what can they do about it? Everybody thinks that.
Right, right. Every person thinks that, their hair fall is more. Now, we just have to sit back and think about what is normal hair fall. So up to 100 to 150 hair fall every day is absolutely normal because hair is a, actively growing part of the human body, and it's outside and it will fall. Anything more than that can be pretty worrisome. So if you think you have hair fall, the first thing, most of the time people come with complaints like, oh, there's too much hair in when I take a shower or when I pull my, hair, too much is coming out. So what can you do for hair loss? So if you have, when you come to a physician or a doctor and you say, I have too much hair loss, then the first thing they will try to see is, if the hair loss is in a specific pattern, because there are some causes that can cause hair loss in a specific pattern versus hair loss from everywhere on your scalp. And obviously, hair is also a mirror of what is going on with the rest of your body. So, for example, if you're going through a traumatic, stressful event, you may see that your hair fall is more. Or if you've been pregnant, you just had your baby, then you can also see that your hair loss is more. We're also seeing a lot of hair loss in the pandemic. So there are stressors that are important to be identified if you're having a lot of hair loss. Um, and what can prevent hair loss? So prevention obviously depends on the cause of, why you're experiencing hair loss. Also, if you're stressed out, make sure that you are taking measures to calm down the stress in your body. And then there are some supplementation that we can suggest to help prevent the hair loss, or depending on the cause of the hair loss, some particular shampoos or growth factors or things like that. So let's say even compared to 12 to 13 years ago when I did my residency to now, we have much more in terms to offer to prevent hair loss and help with hair regrowth.
Hmm. That's great. I told you that the questions will be based on what was asked in the comment section of my earlier video. So people have posted a lot of comments, especially they have asked stuff related to some of the products. So I have to look at this list. So the first thing they say, caffeine shampoo.
Mm-hmm,
Is
mm-hmm.
caffeine shampoo helpful in causing hair growth? I came across a few studies that says it's helpful. What do you think about it?
Right. So caffeine, the studies that were published basically are in vitro, which means that they were done in a lab. They put hair follicles in a petri dish and they put caffeine and they saw that the hair actually kind of grew better than the petri dish which had no caffeine in it. Now, are there real world data out there? It's still not published, but let's look at the risk benefit analysis of using a caffeine shampoo. I really don't see there is any risk in using a caffeine shampoo.
Hmm.
So, yeah, please, if you feel like the caffeine shampoo is helping you, you can go ahead and use it. And
Okay.
it's like a normal shampoo. You wet your hair, you lather it, you let the shampoo sit in for 3 to 5 minutes, and then you wash off. You can use it up to 3 times a week.
Okay, that's great. There are also questions about rice water, turmeric, fenugreek, curd or
Mm-hmm.
yogurt,
Mm-hmm.
beard oil, rosemary oil, and many other oils. So, what do you want to say about this? Do you think any of this works?
Well, it depends on what you're looking at, right? So let's start with rice water. So rice water, in Southeast Asia, we use rice a lot, and it's not a, I think we have rice water almost every day in the kitchen. So rice water contains a chemical called inositol, which actually is a great conditioner for the hair. So it will give your hair a beautiful luster. It'll make it shiny if you use it. They also say if you ferment the rice water, which means that you just keep it overnight and then use it the next day, it makes your hair look much more shinier. So yeah, it's so-called a natural conditioner to be used on the hair. And again, I don't see any risk of using rice water on the hair.
Hmm.
Um, let's see. Fenugreek. Fenugreek
Fenugreek.
not only, yeah, fenugreek or mente that we call it not only helps with hair, it is also useful for a lot of, you know, other body organs. So again, using fenugreek, I would say, is not a risk at all. Um, and then I think we talked
There
about
was
turmeric. Turmeric
turmeric or
can,
turmeric.
right. Turmeric can bleach the hair when you use it topically. So that would be, in the olden days, turmeric was used on the body, like on the arms and legs, especially quote unquote, when you get a tan, when you go outside in the summer, it would bleach, depigment the skin, also bleach the hair. Um, what was the beard oil? I think the beard oil again is a conditioner. It's a nicely marketed product with oil in it, and there was a phase when COVID was at its peak when I think everybody was growing a beard. So that was a great time to market it to help your beard look more healthy and shiny and lustrous.
Mm-hmm.
Um, yeah, there are natural things out there that do make your hair look much better, shinier, healthier. But always, whenever we talk about natural things, we have to realize what is the risk that we're taking if you're going to use it in excess.
Okay. How about yogurt?
Yogurt is a great conditioner as well. So especially yogurt that is spoiled, even I use it. It's
Mm-hmm.
a great pre-conditioner. So you put it on in your scalp and hair, leave it for around 15 to 30 minutes, and then take a hair wash. It can get messy, but it's natural, and you can totally use it.
Okay. How about any fruits and vegetables that can improve hair growth?
Hair growth, yes. So bell pepper or capsicum has some proteins that are really important for hair growth. And they have seen that again, most of these studies are lab studies where you have the hair hanging out in a petri dish, but it helps with hair growth. What are the other products that help with hair growth naturally? Green leafy vegetables, because iron is really important for hair growth, so it helps with hair growth too. So anything that is natural and that has flavonoids and antioxidants in it, they all help with hair growth. So all the green leafy vegetable, fresh fruits, and even coffee and tea also help with hair growth. Tea has chemical called catechin that is also known to really help with hair growth because it is also an antioxidant. It increases the hair circulation, the blood circulation in the scalp. It is also associated with good hair growth. Now, in Chinese herbology, there is a product called ginseng. I have to say it has been associated with some side effects, especially of the liver, if you're taking it without in too large a quantity, or if you already have a liver issue. So that is not a product that I can recommend saying, yeah, fine, there is no risk to it, you can use it. But that is also apparently associated with good hair growth.
Okay, this is fantastic. So you talked about all the natural products. We talked about food items, which is great. So if anyone missed this part, you can always go back and watch this video again. And the next thing in the list is vitamins. So how about
Yeah.
vitamins?
hmm So I think biotin is a vitamin that has gotten a lot of support for nail and hair growth in the recent literature. So biotin is a water-soluble vitamin, which means that it is available in natural, sources, in vegetable sources. Very few people have an actual deficiency of biotin. In those people that do have a deficiency of biotin, biotin really helps. How much does biotin help if there is you are eating all the good stuff, you have all the vitamins that you already need, is not really the data is not really good on that. Now, I have to caution, if you take too much biotin, there is a chance that it can react with one of the proteins that is produced by your heart. So when we test that protein, it can come back as false low. So please don't take biotin in very huge amounts. And I just have to really caution everybody who's watching. that whatever you take, please tell your physician when you go to see them, because if you do have a side effect, that will be the only way that we can monitor it.
Mm-hmm.
Um, and then I think one more important thing that we don't talk about a lot is vitamin D. A lot of us are actually very deficient in vitamin D, especially over here when we don't get good sun exposure. So if you have hair loss, a vitamin D level of more than 50 is considered ideal. So if most of us Southeast Asians over here have vitamin D levels of less than 10, so it's another important thing to get checked and to make sure that you take supplements of vitamin D to get it up to the level it should be for treating hair loss. What other vitamins do we check? Vitamin B12. Vitamin B12 can be deficient in patients who are vegetarians because it's a vitamin that is from an animal source, so that is also important to be checked and replaced. So these are all some of the few, normally occurring deficiency of vitamins that have to be checked and replaced, and that can help with getting back your good hair growth.
Mm-hmm. Great. I have to remind my viewers, for some reason, I'm having some difficulties in looking at the comment section. It's not pulling up. So if you have any questions, you can always post it. We can get back to it later. Or you can always join us live right now by clicking the link in the description below. And you can use any device to join us, and then you can ask a question actually live instead of typing a comment. So the next thing I have on my list is whey protein. So I personally do take whey protein. So I'm worried of hair loss. So is whey protein associated with hair loss?
So I know a lot of people take whey protein, especially if you're like into bodybuilding, if you're working out a lot, and then you lift all those weights, and then you come home and get your whey protein so that it helps with muscle rebuilding and helps with muscle damage. Now, again, there is a very fine balance between how much is healthy for your body and how much is not. So, if you're taking routine amount of whey protein, it's not usually related with hair loss. But so I think here's what happens, right? So you try to build some muscle, and muscle building is always associated with increased testosterone. And increased testosterone is actually kind of what can predispose to androgenic type of alopecia. So if you are doing an environment where you're increasing the testosterone in your body, and then you're predisposed to having androgenic alopecia, that may be one of the reasons why there is an association with it, but I don't think it is necessarily the cause of it.
Mm-hmm. Okay, that's good to know.
Something to
That's
think about.
what is it?
It's something to think about.
Okay, but still, it's a little reassuring, right? Just to have to be careful about it.
Yes.
Uh, okay, so this is great. Next, moving on to shampoos, because shampoo is another hot topic that frequently comes up. So, what type
Mhm.
of shampoo should people use when they're thinking of having to maintain thick hair and reduce hair fall?
Right. Now, I can tell you what are the things should not be there in your shampoo for sure. So we don't want something called parabens. Those are chemicals that can disrupt your hormones in the body. So we want a shampoo that does not have parabens. We also want a shampoo that does not have sulfates, which is again a kind of chemical that can cause some side effects on your body. So naturally occurring shampoos, are recommended. But if you have dandruff to begin with, then we would advise a shampoo with a little bit of Selsun Blue or zinc in it, which will help with dandruff. It will decrease your hair loss. Now, if you have fine, thin hair, then shampoo with a lot of conditioner is going to make your hair look more limp. But if you have coarse, thicker hair, then shampoo with the conditioner is a good one to have. So again, now we have something called dry shampoos, which are kind of helpful. There are a lot of us that have oily scalp, but the ends of the hair become dry. So if you keep shampooing yourself with the normal shampoo, what happens is it can strip your scalp and your hair of all the oils that are secreted naturally by the scalp and is protective of the hair. So instead of taking frequent shampoos, like shampooing every day, it's a better idea to use a dry shampoo, which is basically shampoo that comes as a powder and you put it your scalp only, and you just leave it on your scalp. It takes care of the hairiness of the scalp, but it protects the oil of the other parts of your hair. So that's a good trick to use if you are somebody who does have hairy scalp quite frequently. So again, there is not one shampoo that works for everyone. You will have to change your shampoo sometimes based on, what you're going through in life. But like I said, we definitely don't want shampoos with parabens and sulfates in them. So read all the ingredients of every shampoo that you use or every product that you use.
Hmm. Okay, that was very helpful. I actually have a question from one of my earlier videos. It says, "Does herbal shampoo help with hair growth?" I'm not sure what a herbal shampoo is. It's a brand. I also want to remind my viewers. So we are real doctors. So we don't take the name of any products, and we don't specifically endorse any products. This is meant to give you general education on things. But if you have any specific questions, you can always use the comment section below.
Right. So herbal shampoos. So herbal shampoos can have neem in them. They can have um shikakai in it. They can have various different natural products in it. Again, even if it's a herbal shampoo, I advise you all to look at the ingredients in the shampoo to make sure that the chemicals that we talked about are not there in the shampoo. And then depending on what kind of hair you have, neem shampoo can be useful, or even shampoo with lemon can be useful. So it really depends on the ingredient of the shampoo.
Okay. So let's look at medications, because obviously medications do have some role. So the first obvious question is, what medicines can be used to help hair grow?
Yes. So let me start off with stuff that we have seen, right? So some medicines actually cause increase in thickness of the hair growth and increase in the number of hair coming out of each hair root. Those are the side effects we've seen of some medicines that we wrote. We call it trichomegaly, and it's very interesting because a lot of women use a prostaglandin inhibitor to increase the hair growth of the eyelashes, and that is a side effect of a medicine that we saw, and so that was used to kind of cater to that population. So some of the medications that we use can cause hair growth, but as a side effect of it. Now, let's see. But the medicines that are FDA approved for hair growth are only a couple of medicines. One is finasteride, which is an oral tablet. You take it daily. The other is minoxidil, which is a topical solution or a topical spray, which you put on the scalp. So only these two medicines are actually recommended by FDA for helping with hair regrowth. Um, now, there is a myth that I hear a lot of patients who ask me, oh, if we stop these medications, we've heard we will have more hair loss than what was previous, which is not true. Because what happens is these two products do help with hair growth, and when you stop, unfortunately, the effect of the product does not last. So you are going to have hair loss again. So what I would like to say is you would have to think of hair growth or hair loss as a chronic problem, like say diabetes or hypertension. And if you have androgenetic alopecia, then you have a chronic problem. And if you want to take care of it, it's a medicine. It's a health regimen that you need to be on for the rest of your life. So it's not something that, oh, you apply it once, you take it once, or you take it for a couple of months, and then we have great results that will last you for a lifetime. So it's important to change our mindset that, when you have a specific type of hair loss, you're going to deal with it for the rest of your life. And if you want to get help with reversing it, then you have to take some medicines for the rest of your life.
Mhm. Okay. So I have to tell you that I just saw a comment from a viewer about some healthy nail. I'm just not able to see it again. So if you don't mind typing it again, we'll ask Dr. Nuthan about that question. So if you don't mind, please do that, type it again. Getting back to your medicines while we get the comment. So Finasteride, minoxidil, these are some of the medications. So who should be using these specifically, like finasteride, minoxidil? Is this for men, women? Anybody can use it. What are your thoughts?
So yeah, even women can use it. If women, especially women who have finished child rearing, um, uh, especially perimenopausal and menopausal women can use finasteride. Minoxidil can be used in every age group. Obviously, both of these medications have to be used under the direction of a physician. Um, so basically, both the minoxidil. So what are the side effects of minoxidil? So if it falls on your forehead or your face when you're spraying it, then you can have more hair on your face and forehead. I just read an interesting case report. Um, that there was this baby and the grandfather was carrying the baby on his shoulder and the grandfather was using minoxidil and the baby also had hair growth everywhere wherever the baby's body was touching the grandfather's scalp.
Wow.
Yeah, so it's interesting. So you'll have hair growth where you don't want to have hair growth if you have minoxidil over other parts of the body. Finasteride is pretty well tolerated actually. Um, so a lot less side effects with finasteride, though there was a recent study where there was some concern about depression and finasteride use. But I don't think much came of that. So again, I caution everybody to use these medicines with a doctor's approval. The other medicine we can use is something called spironolactone. It's usually used only in women. It helps with hair growth when women have androgenetic type of hair loss. It also helps with other symptoms that women might have in terms of um, testosterone resistance. But it's an antihypertensive. In a lower dose, it can help with acne. It can help with hair loss in women. We don't use it in men because in men it can cause growth of breast tissue. So that's not something that we use it in men regularly. So again, hair loss therapy is kind of personalized medicine. It's not something that you have hair loss, so you can take this one thing and it'll get better.
Hmm. Okay. So I actually came across a study that said, what is this medication? A new drug called JAK STAT Inhibitor. Well, the pathway inhibitor. It might be a technical term for our general viewers, but can you share your experience with that new medicine?
Yeah, so there are the newest kids on the block. We're very excited with those kind of medicines. So it's almost like precision medicine or personal medicine when we talk about JAK STAT inhibitors. It does help with hair regrowth if your hair loss is from an autoimmune condition. By autoimmune condition, I mean that for some reason your body doesn't like your hair and it starts fighting your hair, so you have hair loss. So it's a medicine that we use topically as a lotion on the hair, and it's great. It really gets your hair growth back. It does not have a lot of side effects, especially when you use it topically. So it is a new kid on block. It is not FDA approved yet, but there are been studies that are looking at it, and I think it's going to get FDA approved soon, especially the oral form for severe alopecia areata. But those are exciting medicines to have.
Hmm. Okay. So I have to tell my viewers I'm still struggling with the comments because doctors are not good people when it comes to technical stuff, but I think I do have the comment section figured out. So if you have any questions, please do type it in the comment section. So I'm hoping it's going to show up on the screen this time. Okay. I'm sorry about all my technical challenges here.
I think I saw a question about nail.
Yeah, I did see a question about nail, but I just can't see it right now, just because of my technical challenge with using this. I'm hoping I can see the question again, so the person can type in again. In the meanwhile, we will continue asking you some of your expertise because I'm so excited about this. I'm learning so much. I'm sure you do as well. So leave it in the comments. What are you learning about this today?
Oh, Dr. Raj, I can actually see some comments on my hand.
Oh, okay.
Can
Go
you
for
see
it then.
them?
I do not
So,
see them uh,
uh,
because
okay, so
technical
I think
challenge.
Savita Swami asked about natural ways to deal with perimenopausal hair loss. How to naturally treat female pattern hair loss.
Okay.
So yeah, perimenopausal, it's that time of life for women that things go haywire, right? I mean, your hormones are all over the place, your skin looks bad, it's dry, you are having a lot of hair loss. Um, so that actually is hormonal. So it would be really good to actually go to a physician and see exactly what is the cause for your perimenopausal hair loss. Again, over the counter biotin can help. Over the counter, there are some great natural sources that are pretty expensive. I cannot take their names, but a lot of my physician friends use it, and they really say that it helps with getting your hair texture back, getting your hair loss back. So it is basically um, a cocktail of vitamins and naturally occurring ingredients, including collagen. And it starts with the name N, but it is something that you can get online, and that will help with perimenopausal hair loss. How to naturally treat female pattern hair loss. I don't think we talked a little bit about female pattern hair loss. So,
Mm.
female pattern hair loss is something where you get hair loss. For example, you take a side, let's say, you part your hair, and then you see that the parting keeps becoming bigger and wider, and you have less hair density as well. Again, female pattern hair loss naturally treated, it is also a little bit hormonal um, in its cause. And again, see a physician, and the collagen and the vitamin mix that I was talking about can help with even female pattern hair loss. And then how to determine healthy nails. So healthy nails. So again, nail is kind of made up of all the same kind of proteins and structures that are made up by that make up hair too. So anything that helps hair can also help nails. So biotin is told that it can help with good nail growth. And like I talked about calcium and vitamin D, that also really is helpful for nail growth. The one thing that I would caution about is, you know, we use a lot of nail polish, nail lacquer, and then when we use acetone to remove the nail polish or the nail lacquer, it does thin out the nails. So don't use it too frequently because that can really damage nails. Take calcium, vitamin D, and biotin can help. I think I have one more question before we can come back.
Yeah.
Um, so what is the test you mentioned that shows a false positive when you take biotin? It's troponin. The troponin levels can be messed up if you take too much biotin. More than one is recommended. So that can happen.
Okay. So I think we did a nice progression. We talked about natural products, we talked about food, we talked about vitamins for hair growth, then shampoo, then medicines. So the next thing in the block is hair transplant. So what do you think about hair transplant? More specifically, who should be thinking of getting a hair transplant done?
Yeah, so hair transplant has kind of revolutionized hair loss for men. So hair transplant is indicated for patients with androgenetic type of hair loss, where you have hair loss more in the front of your head, in the temple of your head. So basically all the hair follicles on the scalp are not created the same way. The ones in the front are more sensitive to the hormone testosterone. The ones in the back are not so sensitive to the hormone testosterone. So you may see that, even if you lose a lot of hair, patients still have a little bit of strip of hair in the back. So what hair transplant does is to harvest the hair follicles from those area and retransplant it, in the area that you've lost your hair. It is an office procedure, so you can go in the morning and come out in the afternoon or evening with your hair transplanted. It is done a lot in India. It has helped a lot of people that I personally know of to get their confidence back. Um, so usually we do it in patients with androgenetic alopecia.
Hmm. So can females have a hair transplant done as well?
Yes, we have tried to do hair transplant um, in females with androgenetic alopecia or something called frontal fibrosing alopecia. That is a uniquely female problem. So we get it. So frontal fibrosing alopecia is again when you lose hair in the front part, but the cause for hair loss is different rather than in androgenetic alopecia. It can cause scarring. So we have tried transplant in those conditions as well.
Hmm. So, when I just randomly looked online as to where to get this done, so there were too many people advertising about hair transplants. If you're in the US, I think most likely it's not covered by insurance. In
That's
most other
correct.
parts of the world, it is an expensive procedure. So the question is, where should we get this done?
Right. So it is a procedure, and I think in US it's mainly plastic surgeons who do it. But in India, dermatologists do it a lot. So you should get it done by a person who has done a lot of these procedures. So that you get a natural looking hairline, they know what they're doing with. But always get it done by somebody who has had let's say a lot of experience in doing hair transplant, and I know a lot of people actually go to India to get hair transplant. It's sort of like medical tourism, like you said. It's not covered by insurance. So a trip to India and get hair transplanted there and come back.
Hmm. So how to find a good hair transplant surgeon then?
Again, look at their reviews, talk to them, ask them, what are the complications that they've seen, how do they handle it, how many times, how many transplants they have done. Do your research.
Hmm. Yeah, so just don't fall for advertising. Do your research. Make sure you pick the right hair transplant surgeon. And if you have any questions, do type in the comments below, and we can always help you with that. Uh, Hair transplant is a surgical procedure, right? So, is there anything that's kind of less invasive, like anything else that could be done as a procedure to do like a permanent fix?
Not a permanent fix, but we do something called PRP injections, which is platelet-rich plasma.
Uh huh.
I mean, you can call it natural because it's basically your own blood that is taken out, and then they centrifuge it in a machine, and they take the plasma out, and they put it back on your scalp. So the theory is that the plasma has concentrated amounts of all the growth proteins that are needed to grow your hair back. It's also called vampire facial in Hollywood. It's pretty famous, where you can also get facial of your face to help it regenerate all the collagen. But we do it to the hair. It's a pretty easy office procedure. Patients with androgenetic alopecia, patients with female pattern hair loss, patients with hair loss, just thinning of hair. If you want to try to have more thicker, fuller head of hair, then it's a procedure that is pretty harmless. It can be done in the office, and it's pretty popular.
Hmm. Well, I told in the beginning of the video that I'm going to share a secret where in 1 or 2 minutes you can actually have a full looking hair, and the transformation is probably something like this. So if you have a thin hair on the left side, and you can make it look like one on the right side, And this is actually by using what is called as hair building fibers. I do not want to take the name of any brand here, but hair building fibers are those products that actually camouflage to give a fuller and thicker hair, and you can get the results in 1 or 2 minutes.
True, true. So it's again one of those cosmetic products that you can get over the counter. You don't need a doctor's prescription. It's great to use if you have an event coming up and you just, want to look a little bit better. So those are available over the counter, and anyone can buy it and use it and feel
Mm-hmm.
more confident. So it's very interesting. In Virginia, they passed something called the Crown Act,
Mm-hmm.
which is basically an act passed by the legislation to not discriminate your worker based on their lack of hair or how they style their hair. So hair is very important, right? And it's a very cultural aspect of your identity.
Mm-hmm.
And especially if you live in a country like, America, where we have patients, people from all races.
Mm-hmm.
And the way we treat our hair kind of also talks about where we come from.
Mm-hmm.
So this act actually says that employers can't discriminate their workers depending on their hairstyle. So, you can't ask your worker not to braid their hair. You can ask your worker not to wear your hair turbans and, a lot of things like that. So, hair and hairstyles are pretty important, a part of your identity, and I can see why people, it can be very distressing to people when they lose it.
Mm-hmm. No, that's good to know. I was not aware of this new legislation, but that's fantastic.
Yeah.
I started by saying I'm going to ask you questions based on the video that I had posted like 6 months ago. So one of the other question I had is about thyroid problems. So people with thyroid problems either knowingly or unknowingly have been losing hair. So
Correct.
what do you want to say about that?
Yeah, so thyroid is this amazing gland that sits on the neck, and a lot of people can have issues with their thyroid. Um, Both decreased level of the hormone that is produced by the thyroid or increased level of the hormone produced by the thyroid can cause hair loss. So, anytime you go to a physician and talk about hair loss, they will have this thyroid hormone tested. Also, if you have other, you either are extremely tired all the time or depressed, or your heart is racing all the time, you have anxiety, that can also be from the thyroid. So it is always a hormone that we check, and if it is low or if it is too high, then we ask you to see an endocrinologist so that the problem can be fixed. But it is an extremely important gland in the body, and it helps with so many other things that goes on in the body along with hair loss.
Mhm. The other type of problem people have been having is dandruff or seborrheic dermatitis, as it's technically called. So, what is the relationship between dandruff and hair loss? Does having dandruff increase or decrease hair loss, or how do people take care of that?
Yeah, so dandruff can actually increase hair loss, and too much dandruff can also be cosmetically very distressing to the patient. I mean, you see all these ads, right? Like where they flip their hair and then there is dandruff everywhere, and the person gets so embarrassed with it. So it is a very, a problem that is out there for everybody to see and comment about. So, like, and it can cause hair loss because you are, like the video shows, you're constantly scratching your hair. It's not a healthy environment for the hair, the roots of the hair to grow in. So the best way to treat dandruff is by, Selsun Blue or zinc peroxide that is there in most of the medicated shampoos. Um, and amla or neem can be a natural way of helping it too. Yogurt can also help with dandruff.
Mm-hmm.
Um, and then sometimes mixing a little bit of lemon with yogurt and putting it in hair can also help with dandruff. So yeah, dandruff is pretty common, but sometimes you try all of this, but you still have dandruff. Then we'll have to use some medicated lotion to get the dandruff under control. And it's interesting, dandruff can occur anywhere where you have a lot of air. So you can have it around your eyebrows, you can have it around the bridge of your nose, you can have it in your ear. So a lot of unchecked dandruff can cause problems there too.
Hmm. And also, the other problem someone mentioned was about having psoriasis or psoriasis, uh,
Mm-hmm.
which is also causes extreme amount of dandruff. Is there any difference with this, or in terms of treatment, or anything to take care of here?
So psoriasis, when it affects the rest of the body, it presents as red, itchy, scaly, where your skin is kind of peeling off kind of lesions, and it can affect the scalp, it can affect the hairline, and can also affect the back of your neck. When it predominantly affects, the part of your body where you have a lot of seborrheic glands or glands that make a lot of sebum or oil, we actually call it sebopsoriasis, which is kind of an overlap between seborrhea or dandruff and psoriasis. We kind of tend to treat them to almost similar because the pathology of it is similar, especially when it involves the scalp and the areas of the face that produce a lot of sebum. So again, we use, like I said, some medicated things to get it under control. Um, when we talk about psoriasis, we have a lot of new medicines that are on the block that we use for psoriasis, and that can help with, if you have psoriasis also.
Hmm. Wow, this is great. And we have been talking mostly about the male pattern hair loss, female pattern hair loss, because these tend to be the most common questions. Although I do have some questions related to what is called as, there was one question where there was alopecia areata. So how is this
Mhm.
different from all these pattern hair losses, and what can people do about this?
Yeah, so alopecia areata is a problem, the autoimmune problem that I was talking about, where your body decides that some of the hair, it doesn't like some of the hair, so it fights against it and your hair falls. Can occur in children, can be very distressing. It usually occurs as smooth wall patches of hair loss. So it's not generalized hair loss. You have hair like just falling off in specific parts of your scalp. So what happens with that? So how do we treat it? Like I talked about, the JAK and its inhibitors are really helpful in treating it. It can be very traumatic if lose your eyebrows or your eyelashes, or I have seen people who have lost almost 100% of the body hair with alopecia areata. So it can vary in severity, and we have new medicines that we can use to treat it effectively. So again, very important to talk to a physician who's trained in this, especially when you're having hair loss earlier. The earlier you seek help, the better.
Hmm. Okay. There was another type of hair loss. We trained in PGI Chandigarh, so we came across a lot of Singh population or Sikh population, and they have a habit of, like tying their hair, pulling their hair, and then putting a pagdi on. So there have been some thing called traction alopecia because of the tightness of how they pull the hair. So is there anything you want to say about traction alopecia?
Yeah, so we see a lot of traction alopecia here too, especially if you wear your hair as a braid, or if you tightly pull your hair and braid it. So we see something called the fringe sign, which means that a little bit of hair that is not pulled is actually growing, but you have hair loss in the hair that is pulled very tightly. So it is a pretty common cause of hair loss here also. So you have to be careful with how you style your hair too. And I think that's something that we did not cover about hairstyling and hairstyling products that can damage your hair. So traction alopecia is one of the causes of hair loss because of the way you're styling your hair. So it's important to actually let hair, be kind of naturally, not to pull it too straight and not to put too much traction on the skin.
Okay. So you just gave me an idea to have you back again on talking about hairstyling and hair products now.
Sure.
Thank you. You know, I did
Go
come
on.
across this. This was not a question, but I did come across this type of alopecia called frontal fibrosis alopecia. Uh,
Mm-hmm.
some of the pictures actually look very scary. I don't have a picture right now in front of me, but is there anything you want to say about that?
Yeah, so it's seen more in females. It's seen more in perimenopausal females. It can be confused with just perimenopausal hair loss, or it can be confused with female pattern hair loss. So it is a type of hair loss where you have the body again fighting against the hair follicle, which causes the root of the hair follicle to actually die. So you have hair loss more in the frontal part of your scalp. And what is scary about this condition is because the hair follicles die and the skin over there gets scarred. If you don't catch it early, then it can cause permanent damage and death of the hair follicles in that area. So it is problem that we are seeing more often, maybe because we have studied it a little bit more and the knowledge and awareness is spreading more right now. But it is a type of hair loss that can be pretty devastating, but it can, because it can also cause you to lose your eyebrows and your eyelashes. Um, so frontal frontal fibrosing hair loss. All these hair terms are pretty long and tongue twisters. But
Yeah, yeah.
anyway, anyway, it is a condition that is not very often talked about because maybe because it's seen more in females, so it doesn't get a lot of, airtime. But it is important. That is this is exactly why you need to see a physician pretty early of your hair loss so that we can make sure that it's not because of something that doesn't harm your scalp in such a bad way that your hair won't grow back.
Hmm.
And there was a recent paper that talked about use of sunscreens and this kind of hair loss. We use a lot of sunscreens here. We should be using a lot of sunscreens.
Hmm.
We should be using a lot of sun protection.
Hmm.
But basically, it's said that we are not supposed to use some kind of sunscreens that have a lot of chemicals in them that can cause this kind of allergic reaction in the front of your hair, causing you to lose your hair there.
Hmm. Hmm. Okay. Uh, I learned a lot. I'm sure you learned a lot as well. I did not know how the time passed by. I have to be very respectful of your time. And is there any questions from the audience?
Yes, I think somebody asked, is there an association between dandruff and hair loss? If yes, how does one control it? I think I talked about it quite a lot. And, if you just look back on this video, maybe 5 or 10 minutes earlier, then you can catch that part of how some of the natural things that can control dandruff. But some of the things, when it is gets out of control, you should obviously talk to a physician about using medicated things to get it under control.
Hmm.
And did I talk about integrative dermatology? It, it is this new field of medicine that I think has stemmed from something called lifestyle medicine. So in America, you have this new field of practice called lifestyle medicine, and
Hmm.
you can actually take an exam now, and you can be a lifestyle boarded a physician, which I am not yet, but some of my friends are. And basically, I think it's far due time for us to talk about, stress, the human body connection, what we put in our mouth, and how it affects the rest of our body. And we need to study this. We all learn Western medicine. In Western medicine, the goal is always to have studies where you have, let's say you take 10 people, 5 people take one sort of intervention, 5 people don't, and then you see if the intervention works or not. But we can all pretty much rest assured, we all know that, the mind controls the body much more than we realize. And it's really important to talk about the human body connection. So stress, again, um, is huge. It's absolutely huge for hair loss. So if you see in the pandemic, and I think we talked about it earlier, the pandemic stress has caused a lot of hair loss. So stress at at a global level as a pandemic, or even at an individual level, if you're going through something in life and you're stressed out, it will reflect in your hair, your nail, and your skin. So it is a natural part of what is happening to your body. So we really have to be aware of it, and we really have to kind of figure out things to make our stress less, so that it doesn't affect the rest of our body. So in that regard, I think our ancestors were much more ahead of us in terms of yoga and meditation, all the things that are patented now, the mindfulness that we talked about.
Yeah.
It's all there in our own thing, and we just lost track of it, and now we are recoining it, right? So if you really want a natural way, then honestly, it's a lot of self discipline. It's a lot of meditation. It's a lot of, practicing yoga and exercising. So again, natural methods are not easy, right? It's in fact, the Western medicine is kind of easy. You pop a pill and you forget about it and you think that it's going to work. But natural methods take a lot of self-discipline. So you have to, willfully commit to a program. Let's say you're very stressed out. You have to meditate. You have to meditate, right? Or let's say, you have a thyroid problem, and we know obviously you need to go to see an endocrinologist, but we also know that doing yoga and exercise really helps all the hormones to come back in shape. So again, natural methods are not easy, but if you're really looking for that natural elixir, more than products, it's what you eat, how much you sleep, how much you respect your body as a temple, and how much you meditate, and how much you practice mindfulness, do your exercise, and practice, yoga or some sort of thing that makes tells your body that you respect it.
Hmm.
So those are all difficult answers to hear, but those are the answers that actually work with a lot of hair loss and things like that.
Yeah.
Sorry, I took off on a tangent, but integrative
No.
dermatology anyway combines all the products that we talked about, combines about mindfulness, combines the yogurt, the lemon, the fenugreek, and everything we talked about, and tries to cater to people with specific problems. But that's a new field of dermatology, and I'm going to a conference about it, but it's more popular in LA and Hollywood.
Okay. See, that was you very well said it, because the importance of lifestyle is so important. So I want to tell our viewers that if you have any difficulty in starting how to do yoga, how to do meditation, I'm not an expert of any of those, but you can certainly look into some of the YouTube videos which are excellent. They go through a nice way of describing everything. I could try to find some links and put it in the description below as well. But do look into some of the videos, and those are so helpful, and that's what I do as well.
Yeah, there are a couple more questions.
Okay.
Um, does dandruff cause pimples on forehead? Yes, yes, it does. So dandruff, again, if you look at why you have dandruff, it's because there is a lot of sebum production. Sebum is a natural oil that is produced by the hair. So when you have more sebum protection, forehead is also an area that produces a lot of sebum or the oil. So yes, dandruff does cause pimples. So if you go see a doctor and you have pimples mainly over here, or we call this the T zone because it's in the shape of a T. So this is the zone that causes a lot of pimples. That's basically because we have a lot of oil producing glands there. So dandruff does cause pimples, and if you control dandruff, the number of pimples on your forehead does decrease and your forehead does clear. Next question is keratin treatment good for hair loss? My keratin treatment, do you mean using keratin supplements, or do you mean the keratin treatment that you get in the beauty parlor, right? So keratin supplements like collagen supplements can help with hair loss. Keratin treatment by itself, if you use a treatment that does not have formaldehyde, because formaldehyde can, again, it's one of the styling things that can cause a lot of hair breakage and hair loss. But keratin and collagen can sometimes are used as natural supplements to prevent hair loss. Again, it all depends on what is the cause of your hair loss.
Hmm. Okay. Thank you for such an excellent session. I do want I want to thank the viewers for hanging in, being so interactive. And if you have any questions, do put it in the comments below. Make sure you hit the like button and share this video so more people can learn about the same things that Dr. Nutan just said. And also, if you're not subscribed to the channel, I do encourage you to subscribe to the channel so you get an update when a new video is going to be released. So I have to sincerely thank you, Nutan, for taking out your
My pleasure. Thank you.
Saturday. I know you're so busy, and I really appreciate this.
Oh yeah, of course it was my pleasure. Thank you for chatting with me today. And thank you for helping me, like I said, when I was, younger and just got in a seat in PGIMER. And we're from South India and I did not know anybody over there in North India. And it is, to be very frank, I think, transitioning from South India to North India was much more difficult for me than even coming here because it's just a totally different world. I'm sure you agree with it, right? Like,
Yeah.
yeah,
So
but it was, yeah, but it was nice to connect with you, and we were fortunate to have trained there in PGI.
yeah, yeah, absolutely. Really fortunate to have been in PGIMER. So that was one of the best experiences in life. Not only we learned a lot of medicine, but also made some good friends, as you can see with Nutan. And Chandigarh is a beautiful place. If you're not been there, make sure you visit it. It's called City Beautiful. And for those of you who are new to this place, it's close to Delhi, and you can always take a train or fly from Delhi to Chandigarh, and it's really beautiful to see.
Yes, it is some of the best times of our life. Yes,
Yeah.
for sure.
All right.
All
Thank you
right.
so much, and
Thank
have a
you.
wonderful weekend.
You too.
Enjoy. Talk
You
to you
too.
soon. Bye.
Take care. Bye.